Good morning, all. If you can't hear me or if I speak too quickly or something, please just put up your hand. There's no sense in my talking to myself. This talk is directed to people who have glaucoma. It's not for physicians. And it follows up on what we just heard in that we need your help. You need your help, and we need your help. Now, what is it that concerns the person with glaucoma? We're taught in medical school that glaucoma is a disease in which the pressure in the eye gets too high and the eye gets damaged, and we're taught a lot about that science. But that's probably not what concerns you. And what concerns you is that when you come down the steps, you don't see the steps and you fall. But that only affected some people here. Other people didn't have any trouble with that. So it depends on the person. Then there's this sort of concern that, well, you've heard that glaucoma makes people blind, and so therefore you just get scared about the whole word. That's very hard to deal with, because dealing with pressure or field loss doesn't deal with anxiety. And so if what you're concerned about is, gosh, I don't know, I'm really worried, then that's what you have to communicate to your physician, so he or she can deal with that. But for most of the people who have glaucoma, they're concerned that they're not going to be able to do things. They're going to lose their independence. As people lose their vision, they stay home more, they become more isolated, they become depressed. And the chairman of our department, who you heard from earlier, Dr. Haller, has been working with a person here at Jefferson, Dr. Rovner, to show that, yes, people who lose their vision frequently get depressed. But that can be helped. And she reported a study yesterday about how working with people who have visual loss can make them not become depressed. It's a very disturbing thing that we physicians often forget that what you want to know is what's going to happen in the future so you can plan. And I recently spoke to a group of people, all of whom were blind, not just from glaucoma. And it was very disturbing to learn that not a single one of them had been told by their physician that they were probably going to lose their sight, and they needed to start planning. So if you're worried about that, ask your physician. There are wonderful services. Now, those are in fact the real concerns. The level of your pressure is what you kind of focus on, but that's not what you really are concerned about. Who cares what your pressure is? Your pressure is only a rough measure of what you can do. Same thing is true of field loss. Well, I want to go through a little bit of science to indicate a little bit more about this. First of all, as I say, a lot of you spend a lot of your time in the doctor's office, in the ophthalmologist's office, almost about 1% of your time just in the office. So glaucoma causes people, some people, to lose some vision. Now this is a graph, and on this axis over here, it has what you can actually do. This is a study to find out what people can actually do. And on the bottom is vision. And what you'll notice is that when the vision is very good, as it is on the right, people can do almost everything. And when the vision is poor, they can't do very much. Now that's visual acuity. That's looking at the reading chart. And there's a very close relationship to visual acuity and what people can do. Now, why do people lose visual acuity with glaucoma? Well, because they have trouble with the surface of the cornea, or they get angle closure and their pressure goes up very high and they lose vision right away. Also, because the drops that we use make people sick. Alphagan tends to make people tired. Timolol makes people tired and confused. So the medicines we use can affect you as a person. So we better not use them unless you're having some real trouble from glaucoma. Now, what we tend to pay most attention to is field loss. That is to say, difficulty seeing other than straight ahead. But this is a correlation between field loss and what people can do. And over here, the same thing. This is what you can do. And up at the top, you can do everything. And down at the bottom, you can't do anything. And over there is field. And yes, when people have really good fields, they tend to be able to do much more. But notice that it's all over the block. Some people with poor fields can do everything. And some people with good fields fall down the stairs when they're trying to walk to their seat. So this really isn't what we should be paying attention to. This helps us determine whether a person's getting worse or not, but you don't really care very much about that. What you care about is how well you can see, because that affects directly what you can actually do. That's what you're caring about. Can you read the chart? And many of our drops affect the surface of the front of the eye, so you can't read so well. So why do people with glaucoma lose function? Well, here in the United States, half of the people who have glaucoma never get diagnosed. In Japan, 80% of the people with glaucoma never get diagnosed. In India, guess what it is? 97% of the people who are going to go blind from glaucoma never even get diagnosed. Now, sometimes people get diagnosed, but they really don't have much and they get overtreated, and that makes them worse. Sometimes they get undertreated. Well, what's the justification for treatment? The justification for treatment is if without treatment you're going to lose function. That's the only reason that a person is justified for being treated, that if they're not treated, they're going to fall down the steps when they come down the stairway here. This is a way to help that. The green means that the person has early glaucoma. They don't have any loss of function. The yellow, they've lost some visual field, but as you've noticed, not everybody who's lost field has loss of function. And down on the bottom in the red zone, there are things they can't do, such as walk down these stairs. Now, the overwhelming number of people with glaucoma are in that green zone. They don't really have functional loss. They have what's called ocular hypertension, elevated pressure. Almost all of you here are already in the red zone. But I'm going to go very quickly through what ought to happen. So the justification for treatment in the green zone is if your pressure is so high that you're always going to get worse, if there's a difference between the pressures which is so great that you're always going to get worse in the future, if there's a difference between the inside of the eyes, which means you're always going to get worse in the future, if that nerve is actually getting worse, and then also conditions that mean that you're going to have a difficult time getting back for your examination. Maybe you live in Africa in the bush. And those people treatment has to be a little bit more vigorous because the person may not be able to get back. So those socioeconomic conditions are important, and I spoke out of line there, I'm sorry, I forgot. If you have a very narrow anterior chamber angle, the next to bottom one there, those people are going to get worse too, even though they don't have any symptoms at all. So those people need to be treated. Now in the yellow zone, well, that's a little different, but let's look down at the red zone, in which you already have some disability. Anybody who's in the red zone who gets worse at all is going to have more trouble. So if you're already having trouble with your vision, then you have to be extremely vigorous about demanding from your physician that he or she do the very best he can to prevent you from losing any vision whatsoever. You want to be treated very vigorously and to prevent any worsening. So the treatment depends upon where you are in your course. Is it very early? Is it very advanced? Because the goal of treatments in the red or yellow zone especially should be to prevent you from getting worse, but there's now information that if you're in the yellow zone, you can get better. And this is a graph that shows the red zone is the visual field getting worse due to glaucoma. Then the person has surgery where that arrow is, their pressure comes down and their vision gets better. There are now several studies out to show that you can't do away with dead cells, but there are some cells that are damaged. And I think that in the future, the only way we're going to be able to tell whether our treatment's really adequate or not is if a person actually gets better. And these are some of the studies that show that. So then, conclusion. When you're working with your physician, remember that he or she is overworked, too many patients to see, too much paperwork to fill out, and it's very easy for the person to get lost. So help your physician. Demand that you be treated. Not your pressure, not your field, but you. The things that are really important to you. And help your doctor with that. If your doctor seems to be forgetting that, remember that he's pushed for all kinds of things, or she's pushed for all kinds, so help your physician. Ask the physician, what is the stage of your disease? Don't forget about your pressure, not what's your pressure, but where are you in your disease, and are you going to get worse? If you are suggested to have a treatment, ask why. Why do you need that treatment? And I want to conclude with the hardest piece of information, and this is tough. This is really hard. But the fact of the matter is, those people who take responsibility for their own health are the people who do best. So, if you're losing vision from glaucoma, look at yourself first. What do I need to know more? How can I work better with my doctor? How can I be responsible for myself that I'm not going to get worse? And that's just a phrase of a reference that relates to the same thing. So I'm very pleased to be able to be here. I'm grateful for the program committee for asking me to talk. And I hope that you will really remember that the importance of glaucoma is what it does to people who can walk down these stairs. And the person who is most responsible for caring for himself or herself is going to do best. Thank you.